How to prevent heart attacks and strokes by managing 4 key health factors. Cardiovascular disease (CVD) is the world's leading killer. We're talking about heart failure, heart attack, and stroke conditions, responsible for an estimated 85% of all CVD-related deaths globally. The statistics are frightening, yet they often overshadow a critical truth. These diseases rarely come without warning. A groundbreaking new study, published in the Journal of the American College of Cardiology, analyzed the data of over 9 million adults, and delivered a powerful, and incredibly hopeful, message. The finding was that more than 99% of people who experienced a heart attack, stroke, or heart failure had at least one of 4 key cardiovascular risk factors above ideal, healthy levels before the event occurred. This demolishes the myth that these devastating events just happen. They almost always give us a warning. To find this, researchers went beyond simply checking for a diagnosis of diabetes or hypertension. They tracked multiple, long-term measurements of vital health metrics in millions of people, allowing them to pinpoint the precise levels that preceded a cardiac event. The conclusion? Our primary focus must remain squarely on these 4 modifiable pillars of health, the 4 major modifiable risk factors. Here are the 4 key areas you absolutely must monitor and manage, which affected nearly all participants in the study. 1. High blood pressure hypertension. In this massive analysis, one factor stood out as the most common culprit: high blood pressure. It affected over 93% of the participants before their event. Think of your arteries as hoses. When the pressure inside is consistently too high, 120/80 mm Hg or over, it damages the delicate lining, making it stiff and prone to plaque buildup. This persistent strain forces the heart muscle to work harder, eventually leading to enlargement and potential heart failure. The core challenge with hypertension is that it's often asymptomatic, earning it the nickname the silent killer. You can't feel your blood pressure rising, which is why regular checks at home or in the doctor's office are non-negotiable. If you notice any elevation, even a mild one, the message from this research is to address it immediately. 2. High cholesterol hypercholesterolemia. The second major risk factor is high cholesterol, defined in the study as a total cholesterol of 200 mg/dl or over, or being on treatment. Too much of the low-density lipoprotein, or LDL bad cholesterol, acts like sticky sludge in your bloodstream. It deposits fatty plaque along your artery walls, a process called atherosclerosis. As these plaques build up, they narrow the arteries, restricting blood flow. Crucially, if a plaque ruptures, it can trigger a blood clot, the immediate cause of most heart attacks and strokes. Managing cholesterol starts with diet, cutting back on ultra-processed foods, saturated fats, and excess alcohol. For many, however, medication, like statins, becomes a critical tool for heart protection. 3. Elevated fasting glucose diabetes. The third factor is fasting glucose, with levels of 100 mg/dl or over, a diagnosis of diabetes, or being on treatment considered non-optimal. When blood sugar is consistently high, it acts as a toxin to your blood vessels. High glucose can stiffen arteries and promote inflammation, accelerating the damage caused by high blood pressure and cholesterol. People with diabetes have a significantly elevated risk of heart disease, because this factor severely compounds the others. Elevated glucose is a clear sign your body isn't efficiently handling sugar. The good news is that aggressive management through diet, regular exercise, and weight loss can often dramatically improve this number, protecting your heart and extending your health span. 4. Tobacco use. Finally, we have the most well-known, yet persistent, risk: tobacco use, meaning any past or current use. The chemicals in tobacco smoke damage the lining of your coronary arteries almost immediately. Nicotine raises your blood pressure, while carbon monoxide reduces the amount of oxygen your blood can carry. Smoking directly contributes to inflammation, clotting, and the acceleration of plaque formation. Smoking is a devastating triple threat that exacerbates every other risk factor on this list. Quitting is the single most impactful action one can take for cardiovascular health. Prevention is the cure. Your action plan. The message from this comprehensive research is undeniable. Prevention works because the warning signs are almost always there. As Dr. Philip Greenland, the study's senior author, stated, if the modifiable factors are actually present in almost all cases, then there is an opportunity for prevention. The immediate action plan for everyone is clear. 1. Know your numbers at every medical visit. Ensure these 4 factors are assessed. Know your blood pressure, your total cholesterol, your fasting glucose, and be honest about your tobacco use history. 2. Focus on lifestyle. While medications are vital for many, they work best when paired with fundamental lifestyle changes. Diet. Prioritize whole foods over ultra-processed foods. Activity. Aim for at least 30 to 60 minutes of moderate intensity exercise most days of the week. Holistic health. Address crucial contributing factors like managing stress, maintaining a healthy weight, and getting quality sleep. Some experts now suggest chronic stress can be as potent a risk factor as smoking or diabetes. 3. Aggressive management. If your numbers are non-optimal, don't wait for a formal diagnosis. Work with your doctor to create an aggressive plan, using lifestyle changes and, if necessary, medication. This research isn't a scare tactic, it's a powerful call to action. It confirms that the path to a healthy heart is well understood and manageable. It's time to stop waiting for a diagnosis and start aggressively screening for and managing these 4 fundamental numbers. If this video helped clarify the steps you need to take for your heart health, please give it a thumbs up and subscribe for more essential health information.